Good deal. All right, we're here again with Dr. Jon Wells from Infinite Regeneration. Dr. Jon, thank you for joining us, as well as Charisma Lewis and Paul Jordan. And it's a great Friday right now, and we've just been spending some time talking about patient empathy and really making connections with patients, having them be heard, and how doctors really need to be listening. So, Jon, you're awesome with empathy. Let's talk a little bit about how you've injected empathy into the practice at Infinite Regeneration.
Oh, that's a great question and can be a lengthy one. I think, we've all had experiences with our medical providers. In today's medical market, we see that a lot of our doctors are on, timers where they've got to get in and out of a room 6-7 minutes in with patients. And sometimes you feel like you're not heard, or maybe you weren't diagnosed. It leaves you with some confusion. A lot of times you aren't taught to understand, the language of what you're receiving or what your options are. And one of the things I've done for years is be able to sit down with people and, get on their level. I realize using medical terminology is confusing for most of us. And so one of the things I like to do is break down what it is that we think you need to utilize in your healthcare that's going to improve your healthcare, and then to be able to teach you about that, also teach you your options, if there's other options that would work for you, and then to honestly, truly listen to people. I think that's one of my favorite things. I genuinely enjoy people. I genuinely love people. I'm doing my purpose on helping people get better to go back to their communities and their families and do what they do. And so for me, I love helping people, and I want to hear what you have to say. So I'm super excited about working with everybody has individual needs. I know they're not all the same. We're not cookie cutter as human beings. We're all different with different concerns. So, one of the things I like to do is listen thoroughly, find out what's happened, what's the history, what your options are, and which way to go with you that best suits your needs.
Right. And you shared with us a few weeks ago your story of really how you got birthed into this side of medicine, and in a very personal story of rebuilding your body, helping yourself. And that's really what empathy is all about, is being able to relate. It's not sympathy, it's empathy, is that connection. You had a lot of success with stem cells. Charisma, you were asking some questions about the different approaches and maybe some of the ailments too. For each person it might be different, a hip, a shoulder, some joint, but there's all sorts of ways that you can use this to improve someone's life. Charisma, you want to talk a little bit about that?
Yeah, I wanted to ask you, Dr. Wells, because I know some patients nowadays would like to prevent surgery, right? So can you talk about some of the common ailments that patients seek you for stem cell injections?
Yes, of course. That sounds great. It's a really cool and exciting times in healthcare. Regenerative medicine basically is, we don't necessarily have to, cut and carve on body parts to get those to function better or completely replace them. Now with regenerative medicine, you can go in the right scenario and regenerate joints. I'll give that joint some new health, reduce its pain, increase its range of motion, and get people back to their normal lives. Probably the most common thing that people show up with is, osteoarthritis, and that's the whole name, degeneration, is basically osteoarthritis in our bodies. Our bodies are breaking down over time as we live. A lot of it's wear and tear, some of it's gravity, a lot of it's lifestyle. One of the new options is to be able to look at a patient's individual needs and review those, typically by your complaints and what your lifestyle has been. Also looking at your radiographs, your MRIs, and then putting a really good plan together where we can go in and inject a joint. Typically one injection does it, and then watch that joint regenerate, a significant amount over a period of anywhere from 6 weeks to 12 weeks. Of course, that stem cell will work for up to a year, and then some of the results that people are getting are as long as 7 to 15 years out of some of these joint procedures.
That's great. What about...
hang on, can you guys cut me for a second? My doorbell rang. Can you give me 1 minute? I'll walk this.
Okay, great. Thanks, Dr. Wells. I know that some patients come to you for knee or osteoarthritis or arthritis, but can we help patients that are bone on bone?
Well, that's a great question, and I'll answer that. That's a multi-layered question. You know, we have helped lots of people with bone on bone reduction in their pain with regenerative medicine. You know, and of course, you know, when you're talking regenerative medicine, it's really hard for stem cells to recreate something that is not there. We've seen people bone on bone get as much as, you know, 10% of the cushion back in these joints. People that have, you know, moderate degeneration or mild degeneration certainly see better outcomes. Bone on bone is a all-encompassing statement that somewhere in the joint space is touching the bones together, or maybe that spot that is wore out in that cartilage is maybe the size of a pea. You know, maybe if it's the size of a 50-cent piece, that's going to be a lot more of a difficult job with stem cells than it would be the size of that pea. So it's going to be based on what your radiographs say, what your lifestyle is, what you're doing currently with your body. You know, matters on weight, matters how fast you heal. Yes, a lot of people end up bone on bone in our clinic. Hey, could you help us? And we've had significant help. Surprisingly, lots of people. I've had people that have been overweight, bone on bone, could not get knee surgeries or hip surgeries that we've placed stem cells in, and they're still pain-free 5 years later. I find that miraculous, and that is the power of stem cells. But I think, you know, it's based on individual needs, but absolutely, yes.
That's great. Thanks, Dr. Wells.
You know, and that's something that it takes time to figure out. You said that, you know, each patient's situation based on their lifestyle, based on their medical history, based on their actual scans, that's the thing that you can't do when you're in there on an egg timer, just getting in, getting out. It's really about sitting down and finding out what that lifestyle is going to be. So could you share a couple of success stories of that? Maybe some stories. I know you have a lot that relate to you. Being an athlete, still being an athlete. What are some of those maybe from an athlete and maybe someone that wasn't, and a success story that you were able to find them success by taking that extra step, taking that extra time, and figuring out if this was right for them?
Oh, you know, there's so many of those that pop into my head. You know, I've had two patients come in the last several months. One of them had just turned 80, and at 60, when he retired, he started to running. And then he ended up swimming and cycling, and now he is, I think, amateur athlete-wise, #1 ranked in the United States for his age. And I think he even had a few sponsors like tennis shoes and some nutrition companies. He came into our office. He had a pretty significant wear and tear in one of his knees from just age and then the sport he had chose. He wasn't in a lot of pain, which was amazing. You know, what he was trying to do was get longevity out of that joint. Of course, a joint replacement was not an option, nor was surgery, because neither one of those would have, you know, supported his lifestyle. And we ended up doing a stem cell injection into his knee. Within 6 weeks, he was back to full range of motion, inflammation gone, and is currently out racing as we move into the summer.
And what age did you say he was?
He was 79 to 80 years old.
Wow.
Oh, wow. Okay.
Started running at 60.
He started at 60. Okay.
Yeah, it's an awesome story. It's an awesome story.
Yeah, that's great. And he's out living his dreams now.
Oh yeah, it's so amazing to see somebody with that kind of passion, that kind of fire in their 80s. You know, it's certainly not the norm. He was so I'd call him your senior athlete. I love running into those people. We had another guy who was a retired school teacher. He was 77 years old, and he had some knee degeneration going on also. He had been to Mount Everest twice in the last 2 years. And he was still doing some mountaineering. He wasn't shooting for the summit. I think he was going to circumnavigate the base or all the way through that Annapurna region. He had just summited Kilimanjaro before he had walked into our office twice also. And he came in for some stem cell regeneration in both of his knees. He certainly wanted to hike and backpack and mountaineer the rest of his life. He had amazing outcomes. He had a little more degeneration in his knees than the triathlete did, but both those fellows are back enjoying their lives and back onto the trails and back into running and swimming. It's just amazing to watch. And I have hundreds of those, but that's my two most favorites.
That's awesome.
Thanks, Doctor. I have a question. It's very evident that you are on a face-to-face and really getting to know your clients extremely well. But now, in the age of COVID, where we're all going to have to be distancing and covered up, what extra things do you do and your practice does to make the people still feel like you've got that amazing connection?
Well, first of all, we're going by all the guiding guidelines for keeping our office clean. We're clean between patients. We do a temperature check on everybody when they walk through. We do a travel history wherever they've been. And of course, if anybody's got any kind of complaints or sniffles, we're obviously not letting them in. Right now we're requesting that you wear a mask. We're kind of towards the tail end of this out here where I'm at in California. Our county is really tiny by all standards. I know that New York's got hit pretty hard where you guys are at. We've had a lot less cases out here, and I think we've had one death related to COVID. So we don't have quite the fear that you have in more impacted spots, but we're still taking the precautions. I think one of the things that we're still doing, several options, you can do some telemedicine with us if you feel like there could be compromise going on, or we can also do some work over the phone, texting and or email, or I can even do some FaceTime over the phone with you if that works. But we're still seeing patients, what we call direct to office, where I actually sit down with you and review your x-rays and your radiographs and find out what your individual needs are. There's a space and some separation. I think there's at least 6 feet, maybe more. Everybody's got their mask on, but it's still warm, relaxed. We're still listening. We haven't had that change our approach to listening to your needs and helping you. We still take plenty of time to hear about your case and your individual pain. So we've taken, precautionary standards to make sure that, we're trying to be as virus free as possible. And then, but we're still working with patients, which has been, awesome.
Yeah, that's remarkable. You've been able to keep seeing patients through this whole time, and making yourself accessible, I think, is the key. Wherever somebody's coming from, based on, like you said, their comfort level. If they're uncomfortable, they can still get the information. They can still talk to you, the Zoom call, text, all those different, little pieces of technology, I think are great. And you've been doing a great job, making yourself and your practice accessible to patients. What do you see changing with how people are approaching doctor visits and how they're approaching thinking about their health now that maybe priorities have shifted? Do you see anything changing there?
Well, I think, I don't think people's aches and pains have changed due to this. I think people are still in serious need of regenerative medicine. I think people are, now a little more open to the fact that, hey, surgeries are invasive. People get, all kinds of problems when they go into surgery centers. I'm sure surgery centers now back themselves up too, keeping their places as clean as possible. But I think, our procedures are a single injection. Typically, it could take as little as 15 minutes. And so I think there's a lot less compromise. I think you see a lot more people reaching out for that avenue now. Now there's a lot more research out on it, and there's a lot more, clinical outcomes that are out on it now too, and great results with regenerative medicine. So I think people just in general are a lot more, aware of the fact that when you start doing replacements and or surgeries, you're opening up your body not only to the surgery, but to everything else that's around. So we're seeing more people reach out on the regenerative medicine model now that we've all been through this new big transition here on the planet.
That's excellent. And I know you're coming out with some more content. There's some content coming up about telemedicine and accessibility. There's some case studies coming out. We've got a whole slew of reviews of actual patients. You mentioned a couple of your favorite stories, success stories, but there's just this ongoing stream of positive results that we want to be sharing more of on social media, on your YouTube channel and things like that. So it's exciting. Any other questions for Dr. Jon before we call it a wrap for today? Excellent. We'll catch you next week. Jon, thank you so much for your time. And
Yep, thank you.
Exciting to see all of this continue to progress.
All right.